Hi guys, today we are talking about thrombophlebitis, which is thrombus or clot formation with associated inflammation in an extremity. So the first thing we're going to talk about is risk factors for thrombophlebitis. The first one is Virchow's triad, and there are three components of this. The first one being venous stasis, the second being damage to the inner lining of the vessel, and the third being hypercoagulability of the blood. Another risk factor is the patient's medical history. So we're going to go over a few things that can contribute. A history of thrombophlebitis, pelvic surgery, obesity, heart failure or a myocardial infarction, AFib, immobility, pregnancy. Okay, so those are our risk factors. Now we're going to talk a little bit about assessment of these patients. The first thing we're going to look at is we're going to see unilateral findings on the affected side only, right? So on the affected side, we're going to see pain, warm skin, redness, tenderness, and a febrile state. The second thing for assessment is we're going to confirm the clinical picture with some diagnostics. The first one being an ultrasound to visualize. The second being the D-dimer. We're going to product of fibrin degradation present in the blood after a blood clot is degraded by fibrinolysis. Positive equals clot. Okay, so again, ultrasound and D-dimer. Now let's talk about therapeutic management. If the client has confirmed DVT, first, no SCD or TED, no massage. We're going to do bed rest because we don't want to dislodge the clot. Second, we're going to initiate anticoagulant therapy. Heparin, and then we'd have to monitor PTT every 6 hours. Coumadin or warfarin, where we'd have to monitor PT-INR. The third would be an IVC filter. It sits in the inferior vena cava and collects clots before they reach the heart or lungs. We're going to monitor for signs and symptoms of emboli, heart, myocardial infarction. We're going to look for chest pain. In the lungs, we're going to look for pulmonary embolism. We're going to look for anxiety, shortness of breath, increased heart rate, increased respiratory rate, and chest pain. In the brain, stroke, we're going to look for facial droop, arm weakness, or speech difficulty. We're going to monitor distal pulses, and we need to do clotting, prevention, and monitoring. So we're going to monitor the circumference of the limb, BID. Second, SCD or TED, plus enoxaparin sodium, anticoagulant, if ordered by the provider. Third, passive range of motion. And fourth, early ambulation. All right, guys, so again, this is for thrombophlebitis, which is a clot formation with associated inflammation in an extremity. Happy nursing. This has been another episode of NCLEX Flash Notes Podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's nclexbook, NCLEXBOOK.com. Happy nursing.